Welcome to the sixth international webinar of 2022 organized by Vet and Clinical Advance. My name is Alba Martos and I'm the International Vet Manager of Affinity Pet Care. And today we are here with Luis Feo. Good afternoon, Luis.
Good afternoon, Alba.
It's a pleasure to share this session with you, so many thanks for your time. First of all, I would like to present him. Luis is a European diplomate in internal medicine, and he is currently co-head of the Department of Internal Medicine and Oncology in the Arts Veterinary Hospital here in Barcelona. And today we will talk about the key aspects in the diagnosis and management of feline lower urinary tract disease. Before starting, I would like to encourage you to take advantage of this occasion because you can send us your questions here on the YouTube channel. But in case we do not have enough time, please send your doubts to the email you can see below in the screen and Luis will answer you. On the other hand, remember that you can download the presentation clicking on the link you can see below too. And well, that's all from my side. I will not delay any longer and we'll start the session. As I said, we will talk about feline lower urinary tract disease. We have prepared different questions, but I would like to start with one of the most basic one. That's which are the most clinical signs of feline urinary tract disease. So, Luis, can you tell us what we can expect in front of a patient that maybe has this disease?
So first of all, thank you very much for the invitation. Again, it's a pleasure to me to be here again. And let's start with the clinical signs. Yeah, as you already mentioned. So first of all, we need to define a little bit what is the feline lower urinary tract diseases. So it's a group of conditions that affect the urinary bladder and urethra, and typically are characterized by these clinical signs that you can see in the screen. So periuria is quite a common clinical sign that we see in this patient. It's an inappropriate urination outside the litter tray that most of the patients have this clinical sign at presentation. Also, it's important hematuria. Many times we see the patient that presented with hematuria or pigmenturia, and also dysuria. That it's a general term that it's a painful or difficult urination, and in this term you have estranguria and pollakiuria. However, in cats sometimes it's difficult to see these clinical signs because they urinate in the litter tray. So a lot of time you see only periuria. When we talk about periuria or inappropriate urination outside the litter tray, the first step is to determine whether the behavior is a medical or a behavior problem. Any medical problem must be ruled out, even that apparently it's a behavior issue. So you have to remember that any disease that can cause polyuria, estranguria, dysuria can trigger urination outside the litter tray. And we have to include disorders of the upper and lower urinary tract and metabolism conditions such as hyperthyroidism and diabetes. It's a quite common situation. Other important things when we have a patient that is urinating outside the litter tray is that other medical conditions that cause pain or reduce mobility can also have a direct impact on the litter tray use. And probably we need to think into a group of diseases. One is osteoarthritis that can cause pain and difficult to go inside the litter tray, and also cognitive dysfunction syndrome. And just to remember that around 35% of the cats older than 11 years old have this dysfunction, so they can have this inappropriate urination, and it's important to remember. And also because our cat and always are difficult, the presence of a systemic disease does not exclude the presence of a behavior problem. And maybe you have both situations at the same time, a medical and a behavior problem, a combination of these two. Also, it's important, I think, like to remember that that most common in cats it's uncommon to have feline incontinence. So it's in the dog it's a quite common clinical sign, but in cat it's less common. But when you have feline incontinence or incontinence, urinary incontinence, what I mean, you have to think probably the majority of the cases have spinal cord disorders or urethral diseases. And the most common urethral disease, they have most of the time they have urethral obstruction. But you can have also incontinence with other problems like urinary bladder disorders, like UTIs, and even they can have urethral diseases like urethral obstructions. But I want that you remember that most of the cases will have spinal cord disorders or urethral disorders.
Okay, so now we know the clinical signs, but with these clinical signs, which are the main differential diagnostics that we have to do? What's your opinion about that?
So for sure, everybody knows that the main differential is idiopathic cystitis, feline idiopathic cystitis, and probably is this around 2/3 of patients with feline urinary tract diseases or disorders have idiopathic cystitis. However, there are other important disorders that you can have or other differential diagnosis really important. Urinary plaques, tract plaques are quite important. Urinary stones are also important and less frequent but than idiopathic, but also important. And UTIs, and as you can see here, UTIs are less common, but probably UTI will depend. If you have a UTI, will depend about the age of the patient. When it's quite common in older patients, less common in younger patients.
Let's move now about what which diagnostic test we have to use to see which is the main disease for these patients. Can you explain us more or less which are the main ones?
Yeah, so I think like one of the big diagnostics tests that you need to do, it's a complete physical examination. Even that is not a test, it's really, really important. So we know that the site of the bladder it's really, really important. If we have an enlarged hard bladder, you can have an urethral obstruction. So, and I think it's really, really important to know just at the beginning, because if you have an urethral or a cause of obstruction, you need to go faster in your diagnostics. You need to do abdominal ultrasound and abdominal radiographs as soon as you can. But what are the main tests that you need to do in this patient? For sure, after you are finished your complete physical examination, you need to do a CBC and biochemistry panel. And it's important in your biochemistry panel to include ionized calcium. Just to remember, and we will talk about that later, it's quite common to have hypercalcemia in some types of uroliths. So I think it's really important to rule out systemic diseases like pyelonephritis or other systemic disease that can cause these clinical signs. For sure, a complete urinalysis is really, really important in these cases, and we will discuss about that. We will talk about that later. For sure, urine culture is quite really important. And if you have a renal disease, a chronic kidney disease, for example, you need to do also a UPC ratio to check if you have proteinuria. For sure, as already mentioned, abdominal ultrasound and abdominal radiographs are very, very important. And it's important to remember that when you are doing abdominal radiographs, you have to include all the urethra. Just to remember that abdominal ultrasound and abdominal radiographs are complementary tests. You should not choose one beside the other. You have to understand that sometimes you need both, and many times you need both. And just to remember that feline idiopathic cystitis is that for diagnose a feline idiopathic cystitis, you need to rule out other etiologies. So that's quite important. Uh, this is one of, I want to bring here this case because it's kind of example of how abdominal ultrasound and abdominal radiographs are complementary tests. This patient presented to us with dysuria and hematuria, and the abdominal ultrasound was normal. And as you can see in the abdominal radiographs, in the urethra, you can see a few stones there. So this is kind of a typical example, a classic example that you need to combine these both tests that are quite important. Also very, very important, I think, that just to remember that you cannot see all the stones or the uroliths on the radiographs. Just good thing to remember is that the radiopack stones that you can see in radiographs are calcium oxalate, calcium phosphate, silica, and struvite. And the stones that you won't be able to see in radiographs are cystine, urate, and chantine. So if you have one high suspicion of urate, for example, you won't be able to see it in the radiographs. Um, there's some exceptions based on the size, but are less common. Just to remember that most of the cases you need to do, if you have calcium oxalate and strobite, you will see on the radiograph, but there are other situations that you won't be able to see it. For sure, I mentioned the most frequent tests that you need to perform in these cases, but sometimes you need additional tests like catheterization with contrast, with urinary contrast, as you can see in these radiographs, because you won't be able to see what's going on with this contrast product. And as you can see in this radiograph, we have a urethral rupture due to traumatic catheterization. And sometimes you need an additional test like this, but it's not the most frequent situation.
Okay, so thanks. We have seen different diagnostic tests, but I would like to go more deeply into your analysis. So maybe you can share with us the role of this test and also its advantages, disadvantages. What's your opinion about that?
Yes, Alba, I think it's really, really important to think that urinalysis is a very, very important test in these cases. But first of all, you need to know how to deal or how to handling these urinary samples. So there are a few assessments quite important that you can see in these slides. So first of all, the fresh urine makes the best sample for a microbial culture and cell morphology assessment, and probably you should assess this urine in less than 24 hours. So if you have a sample that has been in your refrigerator for 3 days, forget it. This sample is not good enough at that moment. A second thing that you need to know is the sample should be centrifugated immediately for evaluation of the urine sediment, particularly when you are studying or you're assessing the urinary infection or neoplasm, when you're assessing the type of cells that you want that they're in the urine. So I think that's quite important. Also in cats, it's quite common that you have a microscopic hematuria when you have done cystocentesis. So and this is quite common in patients with cystitis. So I think just think that sometimes you will have a marked hematuria due to the procedure, the cystocentesis. Also important thing just to remember in cats, also in dogs, but I think it's more important in cats, is that urine collected via spontaneous urination are not recommended for cultures. So we need to do cytocentesis in most of the cases. But just going through the urinalysis, I think there are a few important things. Most of the time, we think a complete urinalysis is just to do a urinary distich and a specific gravity, and that's it. And I think when we think in a complete urinalysis, you have to evaluate the color, the clarity of the urine, specific gravity, urinary distich, and obviously you need to evaluate microscopic sediment analysis. You need to evaluate the sediment, what you have in the urine. And there are two ways to evaluate the sediment. You can evaluate with and without staining, I will say. And I think when you evaluate without staining, you will evaluate much better if you have crystalluria, if you have any type of crystal like here. And when you stain the sample, you will see much better the cells, the type of cells. If you have bacteria, if you have intracellular bacteria that are quite important when you are evaluating infections, and tumors. Also, it's important to remember that the urine sample should be ideally be kept at room temperature and evaluate within 16 minutes to avoid false results of crystalluria. If you put in the refrigerator, the crystal will change. So I think like when you have a patient and you need to know if you have crystalluria or not, you should go fast in your evaluation. I think if I have to say something important in this webinar, this is one of the slides that I think are more and more important. So sometimes we tend to consider crystalluria as pathologic, and I think there are a few assessments quite important here. So crystalluria does not confirm the present urolithiasis. So sometimes you can have crystalluria of, for example, struvite or calcium oxalate, but this doesn't mean that you have an urolith. And this doesn't mean that you need to change the diet at that moment. It's very important to assess the crystalluria with other tests like abdominal ultrasound, abdominal radiographs to be sure that you have or you have not urolith. Because the presence of crystalluria will not necessarily lead to the future formation of stones. So you should not do a change in the diet just based on the crystalluria in most of the cases. Other important thing is like sometimes you have urolithiasis in the absence of crystalluria, and that's happened sometimes. And this is because once the stone has formed, sorry, it is thermodynamically more favorable for minerals to deposit in the surface of the already formed stone than to form a new crystal. So sometimes you have a urolith and you won't have crystals, or you will have a different crystal. So, and I think that's relevant. As we know, cats are different, and although crystalluria, struvite crystalluria, is quite considered not pathological or clinically insignificant, sometimes could be important. So we know around 30% of cats with struvite crystals have hematuria because the crystal irritates the bladder mucosa. And that's not the most frequent scenario, but you can have this situation. So when crystalluria is detected, my recommendation is to determine whether there is a concomitant disease or not. If you do not have a concomitant disease, maybe you should treat this crystalluria. But just be sure that you don't have any concomitant disease at that point. Also, important thing about the hematuria is that this hematuria in these dogs and cats can affect your UPC ratio, your protein in the urine. So if you have a lot of blood, you have a marked hematuria, and you have a high UPC ratio, my recommendation is to consider or to recheck this UPC ratio after you have resolved or you don't have hematuria anymore, because probably your UPC will decrease.
Thanks, Luis. I think that now we have a very good idea about urinalysis. The next question is about the stones you have mentioned during these first slides about struvite, oxalate. So can we see the most prevalent stones in cats? Do you have any data about that?
Calcium oxalate and struvite. They are the two most frequently stones that we see in cats. For sure, there are other ones, but between these two ones, we have around 90% of the cases. So these are the main stones that we tend to see. In the last decade, probably the prevalence have changed a little bit. And what we see now is probably we have a little bit more of struvite compared to calcium oxalate. We don't really know why, but we are seeing much more struvite stones than calcium oxalate. Maybe it's related with the changes in the diet, or but we really don't know why. But probably at this moment, struvite is more common than calcium oxalate. But for sure, there are other important ones that you need to remember. So the third more common one is urate, and they're less frequently seen silica and dry solid blood. That is kind of a specific calculi or specific stone that you see in cats. It's the dry, it's the blood gets really thick and can cause also obstruction sometimes. I think when we think the prevalence of these stones, there are also important things about general predictions about the stones, so where are located. So for example, you have here some assessments that I think are really important. So in general terms, calcium oxalate and struvite stones are found in the bladder in equal proportion. So, so you can have in the bladder any of these stones. But we know that nephroliths and ureteroliths, so in the upper urinary tract, most of the times are calcium oxalate. There are also some breed predisposition. So we know that domestic long hair can have calcium oxalate and struvite. Himalayas, Burmese, and Persian, they tend to have calcium oxalate, and there are other breeds like Siamese, you can see more urate. However, these breeds can have other stones. So it's important to remember that it's not exclusively affected by these predisposition factors. In general terms, we know that older cats normally develop calcium oxalate stone, while younger can suffer more from struvite stone. But this is a really general consideration. Entire and castrate males are more likely to have also calcium oxalate stones, and indoor cats are more likely to have also calcium oxalate.
Okay, so you have mentioned that struvite and oxalate are the most common ones. So what else do we know about them? You have more information about struvite and oxalate, or what can share you can share with us about them?
So we'll talk about the two more common ones here. So as we know, the struvite is the magnesium ammonium phosphate stones, and it's important to remember that urine must be oversaturated with the minerals that precipitates, and this is magnesium, ammonium, and phosphate ion before uroliths can form. So you need that oversaturated urine. The important thing about that in this stone is that urine can become oversaturated with struvite in the presence or absence of a urinary tract infection. And we know that infection-induced struvite are frequent in dogs, the most common form in dogs, while sterile struvite stones are more typically in cats. So in cats, most of the time, you won't have an infection. As I already mentioned, it's more frequently seen in young cats. However, you can have even in the late stage of the life, but most of the cases has less than 6 to 8 years old, and they're equal distributed between males and females. So how we treat these sterile struvite stones when you don't have an infection? So the treatment of choice is medically dissolution. We know that if you use a low magnesium diet and urine acidifying diets, you will have a dissolution most of the time in between 2 to 5 weeks, as you can see in this paper from Minnesota. However, if you don't have a dissolution in this period of time, maybe you have a compound or mixed urolith, and that's important to remember. If there is an obstruction, it's also very important, is if there is an obstruction, a lot of clinical signs, or the stone is not bad in urine, stone should be removed as by other techniques, because you cannot wait to this medical dissolution, or your medical dissolution, it won't work. When we talk about calcium oxalate, the second more common urolith that you see in cats, uh, probably the etiology is a little bit more complicated, but what we know is the calcium oxalate uroliths formed when the urine is oversaturated with calcium and oxalate. However, there are other high molecular weight proteins involved in this calcium oxalate formation. And these proteins are nephrocalcin, uropontin, and other mucoproteins like TAM-HORFOL. It's very interesting in cats that hypercalcemia is also associated with an increased risk of a calcium oxalate urate formation. And we know that around 35% of cats with calcium oxalate urolithiasis have hypercalcemia. And it's very, very important to know that. Um, how we treat these patients. So for sure, the treatment of choice is extraction by minimally invasive techniques or surgery. It's ineffective. The medical treatment is ineffective to remove these stones. And what we know is that you can also, after you have removed these stones, the only effective treatment is or the only thing that you can do is to minimize the recurrence. How you can minimize the recurrence of these stones? So you should prevent or control hypercalcemia if it's present. If it's not, don't worry. But if it's present, you need to control or prevent it. You also need to reduce, we know that it works, reduce urine concentration. If your urine concentration is in cats is less than 1030, probably you will have more chance to not recur. Also, it's important to prevent urine acidification and to avoid high protein diets. If you do that, probably you will have less chance to recurrence in many cases.
Thanks, Luis. So you have mentioned the option or the need sometime to remove the stone, but which are the steps after removing the stone? So what do we have to do after that? Which are the best option for that?
Yeah, so first of all, it's very important to remember that when we think in urolith composition, we have three types of uroliths. The first urolith that we have, or the first type that we have, is a single mineral urolith. That is a urolith that contains at least 70% of single mineral type. And this is the most frequent situation. The type 1 is what you will see in the majority of your cases. However, you can have two other types that are quite interesting and important. The second type is the compound uroliths, and this is uroliths uh, whose nidus and layer are formed from different mineral types. So, for example, you have a nidus of struvite and you have a layer of calcium oxalate. And we will talk in the next slide what you need to do in these cases. And the third group, or the third type, is the mixed uroliths. What you contain uroliths, what urolith contains less than 30% of one mineral compound with no obvious nidus. And here is the question, the big question. What is the nidus? The nidus is the area, and you can see sometimes it's in the middle, sometimes it's not exactly in the middle of the stone, but it's an area of obvious initiation of the urolith growth, which is not necessarily, I already mentioned, the geometric center of the sample. In general, and you can read here, nidus layer should be the primary focus of preventive measurements because the nidus is the area of the stone initiation. So if you have a nidus of struvite and you have a layer of calcium oxalate, you need to focus your treatment on the nidus. And that is really important because not all the laboratories give you this assessment of the stones. So for example, you can send for free to Minnesota and they will give you a correct assessment of these stones. But there are some labs, they don't give you this information. And sometimes it's important.
Thanks. So we have a global picture about stones in urinary lower tract disease in cats. Let's move now to infections. So how do we have to manage them and treat them? What's your opinion about that?
Yeah, so I think like it's very important to manage correctly an urinary tract infection in cats. What we know is the prevalence change based on the age of the patient. We know that the prevalence in young cats is between 2 to 19% of the cases in this with this syndrome. And but it's really common in geriatric cats and could be around 40 to 45% of the cases. The first step in this, when you have an UTI, is to correctly classify these patients on one of the groups that you can see in your right side. So this classification has changed in the last few years. So let's talk a little bit briefly about this classification. So first of all, we have a sporadic bacterial cystitis. What is a sporadic bacterial cystitis? Is when you have fewer than 3 episodes in the preceding 12 months of bacterial infection with clinical signs compatible with this disease. And so also it's very important to remember what is that recurrent bacterial cystitis. And that's the more complicated cases that you have 3 or more episodes of clinical bacterial cystitis in the preceding 12 months or 2 or more episodes in the preceding 6 months. And when you classify recurrent bacterial cystitis, you have different groups inside this category. You have relapse, that is infection with the same microorganism that after you have removed it. You have a reinfection, infection with a different microorganism. You have persistent, it's a persistent positive urinary culture with the same organism during the treatment. You have not removed the infection, and what is a super infection when you infection with a new organism that developed during the antimicrobial treatment. Also important classification is when you have a pyelonephritis. That's why it's really important to perform a complete CBC and chemistry panel. A pyelonephritis is when you have when you have uh, affected the upper urinary tract, um, for example, the kidneys mainly. And for sure, it's important the subclinical bacteriuria. That is the presence of bacteria in urine with a positive urinary culture, but without any clinical signs. And here's the thing: you need to treat in this category probably a little bit different, and this is what we are going to talk later in the next slides. In the next slide. So, but first of all, in cats, you need to remember that detection is really common to detect a predisposition factor. In around when you have a UTI, in around 75 to 87% of the cases, you will have something else, a predisposition factor that makes you more complicated or makes the infection uh, present in this cat. But however, a predisposition factor does not mean that this condition is harder to treat, as previously was we were thinking. In the last few years, we have evaluated these cases, and sometimes it's not that bad if you have a predisposition factor. You only need to know it, but it's not going to change a lot at the beginning. So, what are the most frequent predisposition factors? You have here in the screen, but for sure age is quite common. The older age geriatric cat, they are more commonly affected. If you have another disease like CKD, diabetes, hyperthyroidism, and also gastrointestinal disease are common predisposition factors, and for sure other local factors, as you can see here. So if you have an incontinence, you have an other infection, or you have a idiopathic cystitis, can cause can be a predisposition factor. But how we treat this patient? So in the last few years, we have decreased the days of the treatment. And as you can see here, we treat a sporadic infection, depending of culture with amoxicillin or TMS, only during 3 to 5 days. We recommend start with no longer period of treatments. And if you don't have any clinical signs after the treatment, we will not recommend to culture this urine. But probably the big difference is in the recurrent infection, or what we call previously complicated infection. So we also start with amoxicillin clavulanic or TMS, depending of culture, because maybe you have to change because you have a bacteria that is quite resistant to this type of antibiotics, and probably you have to change the days based on if you have an array infection that it's only 3 to 5 days. If you have a persistent or recurrence, you have to give a longer treatment for 7 to 14 days. And what we tend to do in these cases is that you culture again this urine after 5 to 7 days you have finished the antibiotics. Also, it's important to remember that if you do not have clinical signs, you should not treat with antibiotic this patient, because probably it's just what we call a subclinical bacteriuria. And we know that you should not treat these patients if you don't have clinical signs. Even though in the last few years we have changed the time, the period of treatment from 2 weeks to 4 weeks to 3 to 5 days to 14 days maximum, we know some cases need longer treatments. So we know that some patients need longer period of treatment of 4 even to 6 weeks sometimes. So just to remember that you should start with these 3 to 5 days or 7 to 14 days in some cases. But if it's not working or it's not enough and you have a recurrence, probably you should go longer.
Thanks, Luis. So, okay, after infections, I would like to ask you about idiopathic cystitis, which is quite common too in cats. So, which are the main ideas that you would like to share with our attendees to take into account when we have to manage this disease?
So obviously, we already mentioned the differential diagnosis. Feline idiopathic cystitis is the most frequent disease with this feline urinary tract, feline urinary tract clinical signs. And we know that this feline idiopathic cystitis is around between 50 to 66, sorry, percent of the cases. How we diagnose these patients? First of all, the history is quite important. We know there is a chronic intermittent clinical signs, more frequently seen in overweight and indoor males. However, you can see also in males, in females for sure. Um, Many times you have a concomitant disease with urethral plaques, crystalluria, and urolithiasis. That makes the things difficult, but you need to think that maybe you have these two problems at the same time. And normally, these episodes usually last for several days, with a median about 1 week. So it's a patient with clinical signs during 1 week. After that, she recovers or he recovers, and after that, she can recur after, um, even weeks later or months later. Remember that it is diagnosed by inclusion of other etiologies. You need to rule out infections, neoplasia, or other diagnosed like urolithiasis as well. So the only way to diagnose this patient is to perform the test that we mentioned before. It's also important to remember that it's quite common they have a recurrent episodes. Between 17 to 65% of the cases will recur during his life or her life. So it's important that you are aware that it's going to recur many times, and you need to tell the owner that maybe this episode will come later or in the next month to years. Also, it's important that the severity of the episode can vary greatly. You can have the severe cases with urethral obstruction. They mentioned urethral here, but we want to say urethral obstruction. So you can have severe cases in around 15 to 50% of the cases. However, you can have also mild clinical signs. It will depend of the patient. It's also interesting to know that it's a very common for different episodes to have different etiologies. Maybe you have diagnosed this patient with a feline idiopathic cystitis, And 1 month later, he presented with the same clinical signs. And at that point, maybe you have a different disease. And we don't know exactly what's going on, but we think like this feline idiopathic cystitis might act as a predisposing factor for other etiology, mainly urolithiasis and plaques. But we don't really know how, but this can happen. It's also very common to different episodes to have different etiologies. So it's quite common that you diagnose a patient with feline idiopathic cystitis, and in the next episode, after 1 month, 2 months, or you can have a different etiology, like urolithiasis, like an infection. So we don't really know why that's happening, but we know that feline idiopathic cystitis might act as a predisposing factor for other etiologies. So my recommendation is when you have a patient that he was already diagnosed with a feline idiopathic cystitis and he presents with a recurrent episode, my recommendation is to evaluate again this patient with urinalysis, culture, and abdominal radiographs or an abdominal ultrasound. When we talk about the treatment, so I think it's easy to diagnose, or most of the time it's quite easy to diagnose this patient, but it's quite difficult to treat these patients. First of all, to understand how difficult it is to treat this patient is that the etiology of it's unknown of this disease. Although multiple factors might be involved, as you can see here in the slides. Increased bladder permeability is one of the possible reasons, neuroendocrine alteration, stress, environmental and genetic factor of the patients, and also comorbidities. So at this point, there is no specific treatment for this disease, but what we know or what we do is that we do a multifactor approach, and we treat with different ways. Also, it's interesting, and it's probably why it's difficult to know what are the best treatment option. Is like in most studies has a low level of evidence-based medicine in this disease. So, and this is probably because most of the clinical signs in the feline idiopathic cystitis resolve within 1 week, either with or without treatment. So it's very hard to assess the effectiveness of different treatments because this patient will improve with or without treatment many times. So that's why it's difficult to assess all the treatments or all the studies that we have published. But how we treat these patients. And I think there are 4 important points in this case. So my recommendation is, first of all, to check if you have an obstruction or not. If you have an obstruction, you need to treat the obstruction. You need to catheterize this patient. You need to be more active in your treatment. But let's think that you do not have an obstruction. If you don't have an obstruction, the control of the control pain is really, really important. And the medication that you will give in these cases will depend on the severity of the case. For example, if you have a quite severe case with obstruction, with a lot of clinical signs, probably you need to go to fentanyl, to methadone, to a drug that is more pain control drug. But if you have a mild case or a case that is quite easy to control, maybe it's enough with buprenorphine or an NSAID. This is the really important treatment in most of the cases during the period of a few days to a few weeks. Also, it's very important to reduce the stress of this patient because we know the stress is involved in the etiology and in the treatment as well. So we need to improve interaction with owner. We need to ask him a lot of questions about how they are interacting between the cat and the owner. We need to minimize conflict if we have another cat. We need to eliminate stressful factors of the patient or noise, or maybe they have moved to a different place in the last few days. So sometimes you need to try to control the stressful factors that this patient has. And you need to provide to the owner, or you need to assess the basic source resources that the patient has. And I have here one of my checklists that I use frequently in these cases, because I tend to ask about they have if they have a safe place for rest or sleep, if they have a satisfactory food, they have changed the food in the last few days, if they have daily opportunity of the cat to play or engage to predatory behaviors. We also ask if we have a multiple and separate areas in multi-cat household for key environment sources. So we need to ask a lot of questions about how they are doing in the house. Obviously, it's really important in this case to minimize the recurrent episode or to decrease the recurrence episodes to evaluate if they have environmental enrichment. Some of these environmental enrichment are in the list that I have already mentioned. But sometimes when it's a difficult case, my recommendation is to talk with an animal behavior specialist, and they can do a consult in the house, and that I will tell you that will help a lot in many cases, because sometimes it's difficult to know exactly what's going on in that house, and with a behavior specialist you can have the key of what's going on. Also, an important treatment, and probably easy to do, is that you need probably many cases to do a dietary change. And what are the main important thing when you are thinking in dietary change? So the first of all that we know, if you will have a decrease in the recurrence if you increase the water consumption, and there's different ways to increase this water consumption, but you need to increase it. And probably if you increase that consumption, you will have less episodes. But if you have also concurrently urolithiasis or crystalluria that you can think are clinically relevant, you need to also give a diet that helps you to control this urolithiasis. And as you can see in the screen, there are a few diets in the market that can help you with that. There can be dry food or moist food. Doesn't matter. Both food are okay in this situation.
Thanks very much, Luis. So we are moving to the last question. We have seen a lot of etiologies that, can be included in the feline lower urinary tract disease, but what other ones can be considered when we have this kind of patients?
Yeah, so we already mentioned that probably a lot of cases are feline idiopathic cystitis, but there are other etiologies that you should consider in these cases. There are a few here in this screen. So for sure, you have to consider in cats lower urinary tract neoplasm, and TCCs, what is transitional cell carcinomas, are probably the most frequently tumor in cats in this location. Also, you have to remember that when you have a device like a sub, like that you can see in the radiograph in your left, it's quite common to have urinary tract, lower urinary tract clinical signs like dysuria, hematuria, or periuria that urinate outside the litter tray. So for sure, it's quite common in this situation. Congenital disorder are not common, but you have to think when you have a young patient with these urinary clinical signs, and for sure, if this patient has been catheterized many times or even sometimes only once, you can have iatrogenic rupture of the urethra or stenosis of the urethra. But talking about probably the main differential diagnosis that you have to consider in these cases are the transitional cell carcinomas. The mean age is quite variable. It's between the most frequently the mean age is 15 years old, but it can present between 5 to 20 years old. But for most of the cases are all cats or geriatric cats. They can present with clinical signs, acute clinical signs or chronic. So that means that you have to have this differential diagnosis in every single case with chronic or acute clinical signs. And the diagnosis is quite simple most of the time. You need to do abdominal ultrasound, and well, maybe it's not that simple sometimes, but you need to do cystoscopy to have a diagnosis many times. But what we know, if you use a multimodal treatment, it's associated with an improving survival. If you combine surgery plus medical treatment, the survival is quite good in these cases based on the age of the patient. So it's kind of similar presentation than in dogs, but obviously less common than in dogs. And I think we are done. Thank you very much for listening, and I'm waiting for your questions.
Thanks, Luis, for your presentation. So we have different questions that we have been receiving during the session. But before starting with the first question, I would like to remind all people that are following us that you can download the presentation clicking on the link you can see below. So, well, we can start with the first question. The first one, it says that, well, there are some studies that affirm that prazosin does not contribute anything or that even predisposes to the problem. So what's your opinion about that? You have experience with this drug?
Yeah, I agree that probably is not really useful in most of the cases. Maybe sometimes helps you, but there are not studies to show you a benefit of the use of this drug. So I would say that it's difficult to consider that it's not effective 100%, but my recommendation will be not use it at the beginning. And if you need it, you can try, but most of the time it won't be really effective.
Okay, thanks. The second question is, well, if we look at the crystals, the question is that it's better or not to centrifuge the sample and take it from the sediment to take it or to use it more concentrated. So which is the best option?
So I will say that for evaluate the crystal, most of the time you don't need the centrifugate the sample. Obviously, it will depend about the concentration of these crystals in the urine, but most of the time you don't need to centrifugate to evaluate the crystalluria. Uh, I I say that I tend to do centrifugation of the sample when I want to evaluate the cells, the type of cells, if we have bacteria, and the centrifugation is more important when you have and not a lot of cells, when you have a few cells there. So I will say that if you evaluate crystalluria, you don't need it most of the time. And if you are evaluating cells or bacteria, you should centrifugate.
Okay, thanks. And the last one, it's more coming from our side, that it's if we should summarize this session in just three small sentences or three small steps, which ones you would recommend?
Well, it's difficult to say in three sentences, but I will say that the first one is like probably not all of the cases with feline lower urinary tract diseases are feline idiopathic cystitis. We have other differential diagnoses, and that's important. The second thing is when you have a feline idiopathic cystitis, you should think that maybe in the recurrent episode you have a different etiology. And the third thing is like if you have a feline idiopathic cystitis, you should approach this treatment in a multimodal way. So you need to think not only with medical treatment, you need to also think to treat this patient or to treat the environment.
Okay, so yeah, now we have arrived to the end of the session. So many thanks for being here with us, and many thanks for all people that have been connected to the session. So well, I hope you have enjoyed, and I hope to see you soon in the next webinar. Many thanks.
Thank you very much for the invitation. It was a pleasure, and I hope I can see you in a different next year.